Alicia?
Hi, Moné. Hi, everyone.
I just want to say hello, hello, hello. We are here to bring you some really important information. And before we get started, I want you to know we're not here to scare you. That is not our intention. We're here to protect you. And the information we're going to bring to you is important because now you will know how to protect yourself. Right, Alicia?
That is correct. We're bringing awareness to this because if my information was out there in the black web, I want to know so I can take proactive actions and protect my personal information.
And that's what's important. So, hello, everyone. Again, I'm Moné Swann, and I'm the CEO of BIVX Wealth Insurance Solutions and Secure65 Health Plans with this important fraud news alert.
And I'm Alicia Alcaino, the CEO of BIVX Wealth Insurance Solutions and Secure65 Health Plans. Why are we here? We're here today to share some important information that may have affected many of you regarding your personal health information. This breach happened last year to Medicare recipients residing in Illinois, Iowa, Kansas, Michigan, Missouri, and Nebraska.
That's right, Alicia. The heartland of the country is where this breach occurred. So if you reside in other states, well, you can breathe a little bit of relief. The Centers for Medicare and Medicaid Services, or also known as CMS, along with the contractor Madison-based Wisconsin Physician Service Insurance Corporation, also known as WPS, have issued a notification about a contractor's data breach that could impact almost 1 million Medicare beneficiaries. Well, 946,801 to be exact.
The company patch is MoveIt software and thought none of its records have been part of its data breach. Now the situation involves a security vulnerability in a software called MoveIt, which is used for transferring files related to Medicare services. WPS is a contractor for CMS and handles Medicare claims. But unfortunately, this security flaw has led to a potential compromise of personal information.
And a new review demonstrates that there may be previous copying of your personal records. So to give you some background, the MoveIt software developed by Progress Software had a security issue that was discovered in late May 2023. Now, a portion of these files had no personal information, but other parts evaluated in July 8th were determined to include information valuable to hackers. So during a time frame between May 27th and May 31st, unauthorized individuals may have accessed files containing protected health information, also known as PHI. Now, PHI refers to any personal health data that can identify an individual and is used in healthcare settings. So for beneficiaries, that includes medical records, treatment details, insurance information, and any other health-related data that is protected under privacy laws like HIPAA. PHI ensures that their medical and health-related information remains confidential and secure.
Now, the information that is valuable to hackers is your PII, also known as personal identifiable information, which encompasses any information that can be used to identify specific individuals, such as name, addresses, social security numbers, or financial data. For Medicare recipients, PII protection means that their personal details are safeguarded to prevent identity theft and unauthorized access to sensitive information, which demonstrate the other personal identifiable information. CMS have issued multiple notices in July related to this third-party administrator who was a user of MoveIt transfer software, says James E. Lee, Chief Victims Officer for the San Diego-based Identity Theft Resource Center. This is the first breach notice related to Wisconsin Physician Service Insurance Corporation, and it is too linked to the MoveIt breach from last year. Reports from AARP in their online account of the incident. Now, CMS and WPS are taking this matter very seriously. They're currently mailing out notifications to approximately 946,801 individuals who may have had their information exposed. If you're one of those individuals, you should receive a letter outlining what happened and what steps are being taken.
Exactly. And for those who may not receive a letter because of, I don't know, outdated or insufficient contact information, CMS is posting a substitute notice online with similar details just for you.
Now, let's break down what this means for you. The letter will include information about the types of personal information that may have been compromised. This can include your name, your Social Security, which is huge, your date of birth, and even your Medicare number.
So it's really important, you guys, to note that while CMS and WPS are not aware of any identity fraud reported as a result of this incident, they're offering support to help protect your information. So do these following things. Use your Medicare card right now, okay? CMS will mail a new Medicare card to you in the next few weeks. And when your new card arrives, just destroy your old card and let your doctors and your providers know about your new card number. Review your Medicare claims notices, so important, because if you can review them, you'll see if your benefit statements or anybody has access to your Medicare benefit statements has used those abilities under your name, and you don't want that to happen. You can review Medicare claims quickly using your online Medicare account.
That's right, Moné. One of the key actions you can take is to enroll in free Medicare monitoring services provided by Experian for a full year. Order a free credit report and consider freezing your credit. This is at no cost to you, and you won't need a credit card to sign up.
Hey, and you can also obtain a free credit report from the 3 major credit reporting companies. Under federal law, you're entitled to 1 free report from each company every year. This is a great way to keep an eye on your financial information.
If you notice any suspicious activities, be sure to report it to your local law enforcement and consider filing a complaint with the Federal Trade Commission.
And remember, your current Medicare benefits are still intact. If your Medicare number was potentially affected, you will receive a new Medicare card in the mail soon. So don't worry.
That's correct. In the meantime, continue using your existing Medicare card. Once you receive the new card, be sure to follow the instructions included with it.
If you have any questions or need more information about this specific incident, you can call the dedicated Experian response line at 833-931-5700. They're available Monday through Friday just for you.
And don't hesitate to reach out to Medicare at 1-800-MEDICARE if you have general questions about your Medicare coverage.
Listen, we understand this is a lot of information and it can be overwhelming, but please know that you're not alone in this. CMS and WPS are taking steps to safeguard your information, and so are we by bringing this information to you.
Thank you for joining us today. We hope this information helps you feel more secure about your Medicare information.
And as always, stay safe, stay happy, and stay golden. I'm Moné Swann.
And I'm Alicia Alcaino. Bye for now.
Bye. At Collaborative Expansion Foundation, we empower seniors by addressing their critical needs and fostering trusted relationships. We combat loneliness, financial insecurity, and access issues through education, community engagement, and support. Guided by our motto, no senior should enroll in Medicare with a stranger, we strive to ensure all seniors receive the care they deserve. Together, we create a caring, inclusive community. Come be a part of our community. Secure 65 Health Plans. We are the vision. We are disruptors. We are changing the way seniors do business. Become one of us. We are your community, and we are here for you. No senior should ever enroll in Medicare with a stranger. AEP annual enrollment period is ongoing, October 15th through December 7th. Call us now at 213-394-8885 or 833-300-4968. Email us at info@mybivx.com. Secure 65 Health Plans, where seniors thrive.